Hope your work week is off to a safe start. You're watching Monday's edition of COVID-19. I'm Min Sun-hee. Korea's daily tally is slightly below 300 today, but officials are on high alert as infections are taking place or have been reported, that is, across the nation. In response to this grim reality, authorities have decided to raise social distancing in the Greater Seoul area to level 2. Now, we have details on that later on in the program. Here first is Kwon So-ah with the latest numbers on the pandemic. So let's begin here in Korea for this Monday.
Yes, Sunny. Well, numbers aren't looking that good. However, we did go to below 300 cases for the first time in 6 days. In fact, Monday's figure stands at 271, but the drop is likely attributed to the smaller number of tests conducted over the weekend. Now, if we turn to our graph now, we do see that for the entire week since last Monday, we were in the 200s and 300s as well. And since Wednesday, cases were in the 300s, also with high figures over the weekend. Again, we are down to the 200s, but we might have a higher number beginning tomorrow. And with that, the country has a total of 31,004 infections and a death toll at 509, with 4 additional fatalities reported in the past day. And also the number of people remaining in quarantine is close to 4,000 now.
I see. And so, as I mentioned at the start of the program, the metropolitan area is supposed to see tougher social distancing measures.
That's right, Sunny. The government made the decision to raise the social distancing measures in the metropolitan area to level 2, which is the 3rd highest out of the 5-tier system. And this just comes days after the level 1.5 measures were implemented. And this had to be done because officials are saying that the 3rd wave of the COVID-19 virus here in the country is in progress. So let's take a listen to Health Minister Bang Neung-hoo on what he had to say on this move by the government.
Many citizens will face difficulties in their daily lives following the implementation of level 2 social distancing measures in the metropolitan region. Economically, it will especially affect small business owners and the self-employed.
What this means is gatherings involving 100 or more people won't be allowed. High-risk facilities, mainly nightlife entertainment venues, have to suspend their businesses. No more dining at restaurants past 9 p.m., only takeout or delivery past that time. And at coffee shops, drinking and eating will be banned indoors. So again, takeout only. And there will also be attendance caps at sporting events as well as schools. Now, these measures will be in effect until December 7th for now. Now, if we take a closer look at the infections by region, 112 cases were reported this Monday in the capital, Seoul. And with the rise in cases here in the capital, the Seoul metropolitan government decided to implement extra measures until the end of this year regarding public transportation as well as rallies. We also have 76 cases in Gyeonggi-do province, 23 in Incheon, and a double-digit figure in Gangwon-do province. And here, the biggest number of military cluster infection has been reported today. That number is expected to be added into tomorrow's tally, that is. And also here in the southwestern part of the country, in the Honam region, also 1.5 level social distancing measures have been implemented by the government.
Meanwhile, so over in the U.S., there's news about possible public vaccination starting next month.
Right, Sunny. The FDA is expected to hold a meeting on December 10th on a possible emergency authorization for a vaccine by Pfizer and its partner BioNTech, with the Trump administration's vaccine program advisor predicting that the first Americans will be able to get the shots a day or 2 days after the FDA approval. Meanwhile, over the weekend, the antibody therapy by Regeneron that was used to treat U.S. President Donald Trump has been approved over the weekend as well. And really, U.S. citizens do need these developments on vaccine as well as treatment, as the figure is now at close to 12.6 million. And 3 million infections were reported in the month of November alone. Over the weekend, we had some critical resurgences in many other parts, with Brazil hitting the 6 million mark, and also Italy has surpassed the cases in Argentina, and Poland has become the country with the 14th highest number of infections around the world. Now, globally, 58.9 million cases have been reported now, and also almost 1.4 million fatalities around the world. And those are the updates I have for now, but I'll be back with more updates after the government briefing. See you in a bit. Sunny?
All right, so thank you for now. Among the risks posed by the prolonged pandemic is that related to weight gain, as people are being advised against activities outside their homes. Well, local officials have come up with a virtual support program for those in need. To take a look.
According to a recent study conducted by Korea's health ministry on over 1,000 adults in the country, some 42% of the respondents said they had experienced weight gain since the start of the COVID-19 pandemic. Studies have also shown that people who are obese are twice as likely to contract COVID-19 and 50% more likely to die from the illness compared to those with normal weight.
거기에 대한 이유로는 몇 가지 설명이 있는데요. 우선 비만 자체가 체내 면역력을 떨어뜨린다는 점 때문입니다. 두 번째는 최근에는 비만이 전신의 만성염증을 유발하는 것으로 알려져 있는데요. 거기에다 코로나19 감염이 같이 겹치게 되면 그로 인한 여러 가지 합병 질환의 발생이 위험이 높아진다는 것입니다.
Obesity has also become more prevalent among children and adolescents, who are spending less time outdoors and even attending school virtually amid the pandemic. In response, community health centers are now operating remote weight management programs to tackle the growing waistlines of their citizens.
유례없던 코로나19의 장기화로 집에서 건강 관리를 할 수 있는 방법을 모색을 해야 했고, 그게 저희 온라인을 활용한 비대면 집중관리 프로그램을 추진하게 된 계기입니다. 아동이 같이 생활을 하고 있는 가정 환경도 굉장히 중요하고 부모님의 영향을 많이 받고 있기 때문에 이제 가족이 함께 같이 건강을 관리할 수 있는 그런 환경을 조성하고자 아동뿐 아니라 가족이 같이 대상자로 선정이 되어서 관리를 하고 있습니다.
The program offers one-on-one management for 100 children in elementary school and their parents, with the help of dietitians and physical education instructors.
선생님이랑 같이 가보자. 내려가고 올라와. 발바닥으로 바닥 밀면서 그렇지. 다시 둘. 상체 좀 더 들고. 그렇지. 그대로 발바닥 밀면서 일어나. 후 호흡하면서.
Through regular consultation and feedback, as well as exercise videos and others, the program helps families to adopt better and healthier lifestyles. Their diets are also carefully managed by having the participants maintain a diary of the foods they eat.
단백질 더 달라고 그러고 고기 달라고 그러고
아까 말씀하신 두부도 되게 좋고 콩도 좋고 그다음에 해산물 같은 거 다음 주에도 식사 일기장을 꼭 써가지고 보내주시면 이렇게 좀 예쁘게 표시해가지고 코멘트도 달아드리고 할게요.
Nutrition plans are customized for each individual, and they're provided with all the dietary information and counseling services they need. It also hands out meal kits that contain ingredients to make healthy dishes.
살이 찌면서 건강도 항상 걱정이 되고 그랬는데 이런 프로그램이 있는 걸 보고 저도 같이 하려고 둘이 같이 신청을 해봤어요.
효과는 있는 것 같아요. 살이 빠지는 거가
먹을 때도 칼로리를 생각하게 되고 그래서 먹는 양이 조금 줄었어요. 전 이 덕분에 조금씩 더 하게 되면서 되게 긍정적인 효과가 있었던 것 같아요.
성장을 하면서 자연스럽게 체중이 증가하는데 그게 너무 과도하게 비만하지 않도록 하는 것이 이제 목표인데 코로나 시대에는 어쨌든 더 유연하게 대처를 해야 되는 것이 필수적이기 때문에 대면과 비대면을 계속 혼용하면서 지속적으로 확대를 해 나갈 계획입니다.
The battle of the bulge is being fought on the sidelines of the global war against COVID-19. And it is hoped that these community-level efforts could tip the scale in Korea's growing struggle with obesity.
It's time now for the regular briefing on COVID-19 here in Korea for this Monday. Now, as mentioned earlier, authorities have decided to raise the level of social distancing in the metropolitan area to 2 in response to daily infection numbers hovering above 300 in recent days. Up on the screen now are the new guidelines to go into effect tomorrow under heightened prevention measures for the next 2 weeks. Under level 2, gatherings of more than 100 people are banned, and here in Capital Seoul, the cap on crowds at rallies stands at 10. Also, 1/3 of all public servants and workers at public entities will adopt remote working from Tuesday. Private firms are also being advised to do the same, but if that is not possible, they are being asked to ensure safe distancing among workers within the office. Civil servants have also been asked to refrain from social gatherings, and should they choose to ignore this advice and then be infected with COVID-19, they will reportedly face consequences. Sports events will need to limit their audience capacity to 10%. Regular religious sermons face a 20% attendance ceiling, while small gatherings for choir practice, Bible study and meal sharing are banned. In the academic arena, kindergarteners, primary and middle school students face a 1/3 attendance limit, but at high schools, the ceiling is at 2/3. High-risk facilities, including clubs and bars, will be required to suspend their operations, while restaurants are allowed to accommodate in-house diners until 9 in the evening. The briefing is about to start. We'll come back to you afterwards.
정은경 청장의 설명이 있겠습니다.
Let us now begin our regular briefing on the COVID-19 response here in South Korea. As of November 23rd, Monday, midnight, we have a total of 255 new local infections and 16 new imported cases. And now the total case load stands at 31,004. Currently, we have 3,956 people in quarantine, and among them, 79 are patients with severe or critical conditions, and we had 4 additional fatalities, and the accumulated death toll now stands at 509, and the fatality rate stands at 1.64%. Also, I extend my deepest condolences to the deceased and the members of the bereaved families. And here are the major updates on our domestic infections by region. First of all, in Seoul, in relation to a prayer center in Dongjaku district, we also had the first index case being confirmed earlier, and we have 13 accumulated cases so far. And in relation to a government appointment short-term academy in Seoul's Noryangjin district, we also have 5 additional cases being confirmed. Total, we have 81 cases being confirmed to date, and among them 69 were the students, and 2 were faculty members, and 10 were acquaintances and family members. And in Dongdaemun-gu district, we have the high school, and this is also related to a church in Mapogu district, and we have 42 more cases being confirmed. In total, we have 76 cases being confirmed to date. And in Seoul's Seochogu district, in relation to a sauna, we also have continued our investigation. We have 15 additional cases being confirmed so far, and in total, we have 56 cases being confirmed. And in relation to a family gathering in Incheon Namdong-gu district, we have 12 additional cases, raising the total to 57. And in Gyeonggi-do province, in relation to Yongin City's Kids Cafe, we also confirmed that 20 more patients have been confirmed. A total of 54 have been confirmed to date. And in relation to a military base in Gangwon-do province, Cheolwon-gun district county, we also have 36 more cases being confirmed. A total of 37 have been confirmed to date, and we are continuously investigating the sources of infection. And in relation to a university hospital in Jeonbuk, Iksan City, we have 7 additional cases, raising the total to 33. And in relation to Kimcheon University in Kimcheon, Jeonbuk province, we also have a total of 15 cases being confirmed to date. And in relation to a family gathering, a friends gathering in Changwon City, we also have 37 cases being confirmed to date in total. And looking at the risk factors and the quarantine measures for the past week, we have some updates. And we have seen throughout the past week, we have a total of 256.6 cases on a daily average of the newly confirmed cases, and this is a rapid surge from the week before, raising by 133. And we also have 11.3 cases higher in our number of new imported cases, and we believe that we are currently having greater infections coming in from other countries as well. And looking at the sources of infection, about 38% were related were new clusters, and also 13.4% were imported cases, and 14.5% or 300 cases were related to the cases that are under investigation, and about 2% are related to nursing hospitals and other clinic centers. And we have seen recently we have been witnessing a sporadic outbreak continuously across the nation, stemming from many facilities and many gatherings, including saunas, cafes, restaurants, as well as universities and education centers as well, including the private academies and religious institutions as well. And we also see many hospitals, including the highest level of university hospitals. We are continuously witnessing continued cluster outbreak as well. And we believe that with the ease of social distancing measures, there were increase of the physical contact with others and more foot traffic as well. And we believe that these are factoring into the widespread cluster infections, and we are very much concerned of a massive outbreak nationwide. And during the past week, we have seen the age group, and below the age of 50, there were about 71.9%. And also for those under the 60, we have seen the proportion grow at a very fast pace. And for those under the age of 20, also increase greatly. And for the past week, we have seen 17.9% of those who are in their 20s. And during the past week, we had 11 fatalities. And looking at the age group, those over the age of 80 were 4, and over in their 70s were 4 as well. And we have 10 people who had underlying illnesses as well. And looking at the sources of infection, according to the regions, in the Seoul metropolitan area, we have 200 cases on a daily basis, which is the threshold of level 2. And in Honam as well, we have met this threshold as well. And to this end, starting from tomorrow, the 24th of midnight, we will be elevating our social distancing measures to level 2 in the Seoul metropolitan area and level 1.5 in the Honam region. And this has already been announced. And next, we also have some analysis of the antibody testings of the new military servicemen as well. And also we have updates on our third national nutrient survey. And we have had a total of 1,379 participants, and they have been selected as samples across 15 clinics nationwide. And during the month of October and until mid-August to mid-October, we have carried out this survey. And we also have looked into some 6,000 new servicemen in the military, and we conducted the antibody testings. And first of all, the third public nutrient survey, and the result is as follows. We have seen that 3 people had shown positive the antibody as well, and we also have 2 people who had the neutralizing antibody as well. And among them, 2 were already the imported cases, and they have been also already confirmed. And also they were one person who had the antibody who were not diagnosed in the community. And in this survey, today, we have also conducted our second surveys, and we also said one showed positive rate, and this was about 0.7%. And also we had one out of the 1,379 cases, and this is only about 0.7% of the antibody ratings, and we believe that there could be some silent spreaders within our community. And we have seen in our military analysis that 25 have shown the antibody, and we also had a few of them also having neutralizing antibody as well. And among the 25, 10 people have already been confirmed with the virus, and 15 were also people who did not been diagnosed with COVID-19. And we have conducted the final results as 0.22%, and we have seen that 0.22% was the antibody development rate, which is compared to a little bit higher than the public nutrient survey, which showed 0.07%, and we believe that the antibody ratings among the youth are a little bit higher than the population overall, and we believe that those in the early 20s, we need to intensify our quarantine measures. And to this end, we also have seen measures to cooperate with the Education Ministry to also try to curb the further spread of the virus among these young population. And we will also conduct offline classes for the universities and also have stricter quarantine for multi-use facilities. And we will also intensify our quarantine for private academies as well. And next, we have some updates on the influenza outbreak here in Korea. And we have looked into the 46th week in our survey of the influenza, and we have about 3.3 patients of influenza out of every 1,000 people, and this is a little bit higher than that of last year's, and this is also lower than the 5.8 cases, which is the average as well. And we have shown that those patients with the respiratory symptoms, we have conducted their sample testings, and we have seen that 117 cases have been analyzed, and we have analyzed the samples, and out of the 117 samples, there were 0 cases of influenza being detected. Rather, we have detected other rhinovirus or other adenovirus, which also spurs the cold-like symptoms. And aside from this, here in South Korea, domestic clinic centers, we also have our special respiratory symptoms samples conducting testings, and about 0.1% were the influenza rate. And we have about 2,000 cases that have been analyzed, and we had 4 cases of influenza, which makes the number to 0.1%, and which is lower than that of last year. And we believe that we do not have a massive outbreak of the influenza virus here in South Korea as of yet. However, for those of you who did not get your flu shots, we ask you to get your flu shot as soon as possible, and including influenza as well as other respiratory symptoms, respiratory diseases in the winter. It is very important that you wear a face mask and wash your hands. Also keep your personal hygiene measures on a daily basis as well. And during the year-end holidays, we believe that there are many gatherings and many events that will be held. And we are currently very much concerned of a possible massive outbreak throughout the community, so we ask you to refrain from going to these gatherings and also cancel these gatherings or switch to non-face-to-face meets. And currently we have seen many cluster infections stemming from gatherings with friends and family members, spreading to office buildings, office spaces, as well as other multiple-use venues. It is very important for you to minimize social contact as well, so we ask you to refrain from going to non-essential gatherings and also get tested as soon as possible if you have symptoms. And when you head outside, please wear your face mask at all times and keep 2-meter distance and wash your hands at all times as well. And the quarantine authorities will currently have seen that the infection here in South Korea is very severe. We need to also enhance our alert level as well.
네, 지금부터 기자님들 질문에 답변 드리는 시간 갖겠습니다. 출입 기자단.
Right, that was Hyun-kyung, Commissioner of the Korea Disease Control and Prevention Agency, with Monday's afternoon briefing. So, what did she have to say?
Well, we're seeing quite a concerning surge in COVID-19 cases. In the past week, the average daily number of domestic infections was at 255.6, which is up by 133.2 from the previous week. Now, infections from abroad, imported cases have also been seeing a rise by 11.3. The average there stands at 39.4. And almost 34% of these infections were linked to cluster infections. And those are not only limited to high-risk facilities, but now also to restaurants, bars, cafes, as well as meetings among friends, families as well. If you just take a look at some of the new cases here in the capital, we have new cases related to a church where the total of infections stands at 76, and also a case related to a sauna, that total at 56. So we see that the total number of cases linked to one cluster infection is much higher than in the previous weeks. And also in Gangwon-do province's Cheoron, a total of 37 infections were linked to a military-related case, and that is the highest infection when it comes to one single cluster infection related to the military. Also, Chung mentioned that there is a concern of a higher number of people in their 20s that are getting infected, which means there are more people with lighter symptoms or even no symptoms of COVID-19 at all. So she is calling for vigilance, especially with the enhanced social distancing measures having been implemented.
Right. All right, so thank you for that. I'll see you again tomorrow.
See you tomorrow.
Elsewhere around the world, Lebanon is currently under a 2-week lockdown following a surge in cases, with daily infections hitting almost 2,000 earlier this month. For more, I have Habib Bata, a journalist in Beirut, live on the line. Welcome, Habib.
Hi, thank you.
Right, so a 2-week lockdown has been imposed since November 11th. Have the daily numbers dropped in recent days? And what is the state of affairs related to COVID-19 in Lebanon at the moment?
At the moment, we're seeing a big effort from the police, a lot of roadblocks on the highway, police cars patrolling all the time. This is unusual for Lebanon, a country that can barely provide electricity. The police are not that active in Lebanon, but they have been, it seems, in overdrive lately. They've issued tens of thousands of tickets. People are still out on the streets, and they've been trying to stop that. But there has been some effect. It seems the number of cases was about 2,000 per day, and now it's dropped to about 1,100 or 200 per day. So definitely it seems that the lockdown has had some effect, but the question is, how sustainable is that?
The video and your words do not match, but that's not something we can do anything about. Anyways, I hear, though, that authorities there imposed a 2-week lockdown instead of a 6-week lockdown as recommended by the World Health Organization, owing to economic concerns, Habib. How severe is that concern in Lebanon?
Well, Lebanon is an economic catastrophe right now. The devaluation of the currency has reached a Venezuela-like level, 80% devaluation of the currency. That means that any money you have is worth 80% less than it was, whether it's salaries or savings. The banks in Lebanon are not really giving money out because of this economic crisis. So people are only able to get a few $100s per month, if they can get that much. So all of this COVID comes at a time of economic collapse the country has never seen. And obviously it's going to be a lot more difficult because a lot of small mom and pop shops are closing, and Lebanon is full of small mom and pop shops. They can't really afford to continue. So people are losing their jobs. People are saying, you know, they're faced with a choice between going hungry and getting COVID-19. And many are saying they were probably willing to get COVID-19 because the chances are probably higher that they will survive from COVID-19 than of not having a job and not having food on the table.
That's quite tragic, Habib. And as you said, so the pandemic comes amid appalling economic hardships and also public misery that were aggravated by an explosion at the Beirut port in early August that destroyed, I understand, a third of the city and rendered some 300,000 homeless. What is the latest regarding that tragic event, and how is it affecting COVID-19 containment efforts?
Yeah, I mean, it's hard to imagine something like this happening at a worse time in a worse place because there was so much misery in Lebanon, and then you had this the biggest non-nuclear explosion since Hiroshima to add to everything, which rattled people's nerves, killed over 200 people, and also destroyed 3 hospitals. Also destroyed lots of PPE that is in short supply in this country that was stored in the port area near the explosion. So people died in the hospitals as well, who were being treated probably for corona and other things because an explosion on top of that, if you can imagine. So it's been very, very difficult, physically, emotionally. People in Lebanon now, anytime they hear any kind of explosion, any kind of, small sound, they think it's an explosion. This has been very difficult for the medical workers as well, working in these hospitals. So a lot of patients had to leave 3 major hospitals. The number of ICU beds in the country is reaching 90% capacity. And Lebanon is a small country. Lebanon is not able to provide basic services. Lebanon is a war-torn country. Lebanon has one of the biggest refugee crises in the world. It's just unbelievable how much more strain the people of this country can take. It's almost like you begin to laugh because you're delirious with how many problems the country has. It's really terrible.
It's really sad. Habib, I also understand there's an alarming shortage in medical workers in the country as well. Please tell us a bit about that.
Well, yeah, if you're a doctor in Lebanon and you were earning $50 or $60 per visit, now you're earning $10 or $5 per visit. So it's, and the same thing with hospitals. Hospitals have lost, an 80% drop in revenue or value, I guess, of your of currency has led to an 80% drop in revenue for doctors, for hospitals. So, a lot of Lebanese doctors, Lebanon has a very big medical industry. Many of them are trained abroad in France or the U.S. and they have foreign citizenships. And those who, will definitely be able to leave and go to Europe or the United States will be making 10 times more money than the people who live here. And it's hard to blame them at a time when, it's very hard to survive on $5 or $10 doctor's visits. It doesn't really cover your costs. And hospitals, too, might close due to this situation because a lot of the products that we use are imported. And, Lebanon's this country, tourism country, doesn't have much industry at all. So 80% of our products are imported. So that makes the cost of goods has gone up 3 or 4 times in the supermarkets. So yeah, people who have the chance to leave will leave. And that's been the case of Lebanon's history, sadly, for the last 100 years. Millions of Lebanese have left this country because they can't afford to live here.
Right. Habib, one final question before you go. How is the local media covering the challenges posed by COVID-19 in Lebanon?
Well, the local media has so much things on its agenda. Unfortunately, in Lebanon, there's so much political news because of the catastrophe. There's no government in the country. So, coronavirus is just one story out of many problems the country is facing. We don't have electricity right now. We're having blackouts for half of the day in the country. There's a lot of economic problems, people out in the street protesting, very angry. The government's not providing any aid for the people, let alone the blast victims of the tragedy have still not received much aid 3 months after the tragedy happened. So, coronavirus is just one of many news stories in the country right now. And it's very hard to justify it being the main story because people are really just struggling to survive.
All right, Habib, thank you very much for making the time to join us live at this hour with your thoughts.
Thank you.
And to our viewers here, we do apologize for the mishap with the audio and video in our connection with Lebanon.
지난 2, 3일간 8월에 이어 3번째 유행이 진행되고 있다고 판단합니다.
단계 상향 조치는 하루의 준비 기간을 거쳐 화요일 새벽 0시부터 2주간 적용되며 유행 상황을 평가하며 연장하거나 조정할 것입니다.
Authorities here are tackling a third wave of infections, and as mentioned earlier, in a bid to better contain the latest outbreak, level 2 social distancing will be imposed in the Greater Seoul area starting tomorrow. Now, for more on the situation here, I have Professor Chung Gi-seok from Hallym University. Welcome back, Professor Chung.
Good to be here again.
And I also have Dr. Alice Hyun-kyung from MizMedi Women's Hospital. Pleasure to see you again, Dr. Tan.
Thank you, Sunny.
Right, Professor Chung, it's been less than a week since the government had raised social distancing to 1.5, and now, starting tomorrow, we have level 2 coming into effect. What are your thoughts on this latest move by relevant officials here in the country?
I think it's an appropriate time to impose a level 2 as of tomorrow, because even the government started 1.5 level since last Thursday, already we met the 1.5 criteria from Tuesday. So it's a week time after last week. Then I think it's quite appropriate.
I see. And Dr. Tan, looking back on the events thus far, what do you suppose was the trigger of, or the potential trigger is going to be the trigger of this new outbreak?
Well, I think what we're clearly seeing is that COVID-19 control and level 1 social distancing measures are not compatible in Korea under the current climate and also the level of asymptomatic spread that we're seeing in the community. On October 12th is when we went down to level 1. And as you recall, it usually takes about 2 weeks for us to see the effects of any measures that are implemented. And sure enough, starting on October 25th, we started to see a relentless rise in the number of domestic cases and also cases of unknown epidemiological link. In terms of domestic cases, the number went up 6-fold, from 50 to about 300, where we're at now. Cases of unknown epidemiological link went from 133 to 453 over that same period of time. Over the weekend, the KDCA, they illustrated what's been going on in the community over the last month. They gave 2 profiles in community spread. The first one was a cluster that happened in the Seoul metropolitan area that started with a middle school student. And over the course of 3.5 weeks, there were 6 degrees of transmission. And from that one case, 87 cases were diagnosed. And the other illustration they gave was a cluster that happened in the Gumpo city, and the index case was a nurse assistant. And from this one case, there were 16 branches of transmission, and the result was 166 cases. So that's what's been happening over the last month. Furthermore, we had the deliberate effort to try to stimulate the economy through coupon promotions, sales promotions. And I think overall what we did is we underestimated the power and activity of the virus and perhaps overestimated our ability to get control of COVID-19 under level 1.
Right. Professor Chung, health authorities now, amid that scenario, are also grimly forecasting the daily cases could hit between 400 and 600 infections within a week or 2. Is this outbreak looking to be our toughest test against the pandemic?
Yeah, I'm afraid we'll have toughest outbreak than ever experienced. Because we are having a winter, and because another important factor is people have lost their alertness, and some people are sick of quarantine measures and etc. And the winter season is very important because particularly December and January is months for respiratory viruses like coronavirus, influenza virus, other viruses, other respiratory viruses. So there are many respiratory patients who should come to the hospital in December and January. So will behave SARS coronavirus too. So we are expecting more of cases these days. And particularly, I'm very concerned about the Seoul area because at this third wave, Seoul already hit a record high number per one day. Just 3 days ago, 154 confirmed cases a day. And still today, we have in Seoul area 109 confirmed cases. So many population, crowded ones, and having a continuous pandemic. So I'm very afraid of we'll have toughest winter ever.
Right, and we are densely populated here. Dr. Dan, adding on to the clusters that you mentioned, one major cluster infection as of now is that at a cram school in southwestern Seoul for aspiring teachers. I believe despite that outbreak, relevant government officials over the weekend held the National Teacher Certification Examination. What are the chances of a further spread linked to this cluster infection?
I'm afraid we might be seeing just the tip of the iceberg from this cluster. We've already had more than 80 positive cases related to this cram school, this study academy, and over 500 of the people who sat for that examination, the teacher credentialing examination, have had to receive PCR testing for COVID-19 because they were patients under investigation. Overall, the education sector is seeing unprecedented COVID-19 activity, and this is throughout all levels of education, starting from elementary schools up through universities. We've never had a situation like this before. Therefore, schools are now running at decreased capacity, and of course, high school seniors and their parents are very nervous because the once-a-year National College entrance examination is less than 2 weeks away. And so this is a very tense situation that we're in.
Right. And along with that, Professor Jung, over the past week, those under the age of 40 have accounted for more than 50% of the new infections. How concerned should we be about this trend? That was also mentioned by Commissioner Jung during today's briefing.
Yeah, it is a good news and a bad news. Good news is because the younger patients are not going to severe or very severe cases. So we have some room for ICUs and other accommodations. But as you know, the younger people moves a lot, work longer, play late at night, and they meet so many people compared to elderly people. So they, and even though, even they don't have a symptom anymore. So even though they have small symptom, they just neglect it. So they may act like a reservoir of COVID-19 viruses, and they go everywhere, here and there. So maybe that's the main source of infection, and then spread to their parents, their grandparents. Then we can see another big break because of younger reservoir confirmed cases, and even including silent cases as well.
Of course. Dr. Dan, as Professor Jung mentioned earlier, he talked about the fatigue, the pandemic fatigue that people are feeling. And it's not, we cannot deny that there appears to be a sense of complacency that has settled in within members of the public and rendering them less committed perhaps to safety precautions. How do you see such attitude affecting the government's containment efforts?
Right. I think the behavior reflects some fatigue, desensitization, complacency, and maybe some overconfidence as well. Some people may falsely believe because they made it safely this far that they can just continue or perhaps relax whatever measures that they were taking, but that's absolutely not true. We have to actually intensify our prevention measures through the winter months to try to get even the same amount of control. Also, people may think, you know, everyone's wearing a mask now and we're doing the QR code screening, and so they can now talk freely with their friends, eat out as much as they want. But that's simply not true. Masks do not give 100% protection. And so we do need to step it up. In terms of our infection control measures, I think we need sort of a renewed sense of urgency to try to get us through the winter months. And the situation in Seoul is very severe. I mean, the total cumulative number of cases in Seoul has now surpassed the total number of cases from Daegu. I mean, that is mind-boggling, but it's true. And of course, the population density in Seoul is 8 times that of Daegu. And over the weekend, all but 2 of the 25 districts in Seoul reported COVID-19 activity. That means it is spread out throughout the city, and we do need to be very, very careful.
It's really frightening if you think about it. Professor Chung, as my colleague Soa mentioned earlier on the program, Regeneron's COVID-19 antibody cocktail that was used to treat the US president has been approved by the US drug regulator. Given this event, how does this event, that is, look to affect the pandemic situation in the US? And staying with that, where does Korea stand with regard to antibody therapy treatment?
Yeah. The antibody news is very fascinating, and even the Trump has cured from maybe from antibody or from spontaneous recovery. But the antibody is targeting for a virus, not whole virus, but particularly the spike protein on virus. If you neutralize the spike protein, then the virus cannot attack our body. So the antigen is spike protein. The antibody made from factory. Then antigen antibodies combined. And then our white blood cells, like a neutrophil, macrophage, and monocytes, can attack the antigen antibody complex and then get rid of on the bloodstream and in the cell. So that's the way the drug works. But in Korea, we don't have many experience about making a new drug globally. And we don't have any experience with making a new vaccine for global use. But fortunately, we have one company which are in phase 1 and phase 2 trial. And I heard that it works. So maybe if they can go to a third phase 3 trial, then we'll see our own antibody treatment medicine in Korea. But the thing is, you have lots of patients, then you can test the antibody. If you don't have many patients like these conditions, then you don't have many patients who are willing to recruit to your clinical trial. That's another hurdle for a Korean company to develop a new vaccine or a new treatment medicine.
I see. For the time being, we can all keep our fingers crossed then. All right, Professor Jung, thank you very much for your thoughts. And Dr. Tan, thank you for being with us today. Right, well, that brings us to the end of Monday's edition of COVID-19. The weather has gotten colder here in Korea, so do layer up before heading outdoors. And do remember to wear your mask, of course, given the escalating numbers of infections in recent days. That is all for today. I'll see you tomorrow.